government shutdown is threatening to cut off access to food for millions of American seniors, and now federally funded aid groups are working to ensure seniors receive what is often their only meal of the day. Meals on Wheels says nearly 13 million elderly Americans struggle with hunger every year. The group helps seniors who are homebound and can't shop for their own groceries or prepare their own meals. I want to bring in Josh Protas. He's the Chief Advocacy and Policy Officer for Meals on Wheels. Josh, thanks for being here with us on this important day. November 1st, of course, marks when this funding does run out, and we are now waiting to see what this ruling exactly will mean. In the meantime, organizations like yours are left in a little bit of limbo. What is the situation right now for you all?
Well, thanks so much for having me on, Jessica. Actually, even before the shutdown, seniors were facing a crisis. 1 in 3 Meals on Wheels programs report keeping a waiting list with an average wait time of 4 months, sometimes up to 2 years for an older adult who's in need of nutritious meals and moments of connection that they may have to wait. So this is before the shutdown. Since the shutdown, the funding stream for Meals on Wheels programs through the Older Americans Act has essentially been put on pause. And at the same time, we're seeing a surge in demand because of the loss of SNAP benefits that starting today until the federal government, USDA, starts issuing those benefits. So it's really a perfect storm of crisis for seniors, and programs are left with little recourse.
I certainly didn't know. I was ignorant of this. How many seniors out there are in need of just getting basic meal and interaction from people? And these are our neighbors and, oftentimes mothers and fathers or, so many people that we know in our communities. It's really surprising how many people are in need right now.
It is surprising, and I think that's part of the problem is that seniors don't really get the same kind of attention that other populations do. And unfortunately, so many seniors have been struggling in the shadows in silence. Our programs providing both home delivered meals and congregate meals. And I should point out, it's not only the meal itself, but it is those moments of connection that deal with the real problems of social isolation and loneliness. We're currently serving about 2 million seniors a year, but we estimate that there are at least another 2.5 million low income, food insecure older adults who we're not serving. So we're serving less than half. And with the lead in information you shared, 13 million older adults are struggling with food insecurity.
Yeah.
And when we don't address this problem, it really costs us much more because we can feed a senior for an entire year and provide those moments of connection for about the same cost as 1 day in a hospital or 12 days in a nursing home. And we know that when we meet their basic needs, seniors can remain independently at home where they want to be, living with dignity, and out of more costly healthcare and long-term care settings.
Yeah, and you mentioned this. People know, I think a lot of people know Meals on Wheels, but they may not know that it is federally funded through the federal government. Um,
Mhm.
and so this funding, the shutdown, definitely impacts you all.
It's a huge impact. Meals on Wheels and the Senior Nutrition Program Network, it's really a great example, a shining example of a public private partnership. About a third of the funding comes through the Older Americans Act, and that's matched by state and local and private contributions. But without the federal piece of that, programs can't run. 9 out of 10 of our programs indicate that they get some type of federal funding. And for more than 60% of those, it's half or more of that budget. So when the federal funding is delayed or stops, programs have to make very tough, almost impossible choices. Most of the programs are telling us that without the federal funding, they're either going to have to cut congregate meals, home delivered meals, or lay off staff. And we know that some programs are already making those tough calls.
And at this moment, again, until that kicks back in, are you all talking with local organizations there? Are you talking? You mentioned nursing homes and hospitals. Are you worried that because there won't be, there's no certainty of those meals getting to the seniors and that touch point, that they may need more access to hospitals or senior centers, things like that?
Yeah, absolutely. At the local level, Meals on Wheels providers are talking to their community partners. I think a lot of community partners are seeing a surge in need, both because of the shutdown impacts, but also the cuts to Medicaid, the cuts to SNAP that are increasing hunger and hardship for so many Americans. And community-based organizations are really scrambling. They want to do the best they can to serve their communities, but they just don't have enough resources to do so. And now with the shutdown and the loss of those federal dollars, it's making things even more difficult.
Yeah. Listen, we talk a lot about the shutdown and the politics of it, but the bottom line is a lot of Americans all across in red states and blue states are being very impacted by this. Josh, thank you so much for helping us learn more about this. We appreciate it.
Thank you.